Hello to all of my friends. Thank you for joining us here today. I'm sorry it's been several days since I've had the opportunity to be with you. It is hopefully near the end of the legislative session, and because of that, we've had approximately 150 bills due. Whenever the legislature is in session, before they actually sign and die, the governor only has 5 days to either sign or veto the bills that have been sent that have passed both the House and the Senate. Fortunately, this year, so far, we've signed virtually every bill that has come before us. We did veto one minor election bill today. It didn't seem to make sense to us, and so we'll work with the legislature on that particular bill coming up forward. But I felt compelled to sit down and come to you tonight because I'm concerned. I'm really concerned with the number of new cases that we're having of the coronavirus. It appears that we had our largest ever total number of cases in the entire time. Remember, it was March the 11th when we had our first case, so it's been 3.5 months that we have been fighting this battle. And I'll be honest with you, I'm tired. I'm tired of the coronavirus. I'm tired of the word COVID-19. I'm tired of having to talk to you about it every single day, just like I know you're tired of hearing me talk about it. You're tired of doing the things that you are doing to help in your communities. But we had 1,092 new cases reported today. That's an all-time high. And it's a lot higher than our second highest day, which was yesterday when we had over 600 new cases. I'll tell you, even in the midst of dealing with approximately 40 bills, I met with Dr. Dobbs for a long time today. We talked about the fact that many people are just giving up and pretending like it doesn't exist, or pretending like this virus isn't going to affect you. Trust me, it is going to affect you. The 1,092 cases, as you look at the profile, and we've got a lot of work to do to look at the data, but it appears very clear that many of these cases are in our young people. They're in places like Oxford, they're in places like DeSoto County, they're in places like the Mississippi Gulf Coast, where there are a lot of young people who are going out, they're partying, they're having a great time, and they're getting sick. Now, it is very true that most young people, they're out gathering in large groups, they're throwing parties, they're flagrantly ignoring the rules, and I know that doesn't shock any of us. And the good news with that is that typically this virus is not as cruel to those young people. Typically, those in the age category of 18 to 30 are not as symptomatic. The virus does not treat them as ugly as it does to others. But you know, every one of those young people has a mom or a dad. They have a grandmom or a granddad. And it is really difficult for them, oftentimes because they're asymptomatic as they're spreading the virus, to not go and see their mom or their grandmom, or their dad or their granddad. And I'm very concerned what's going to happen 2 weeks from now, when these 1,000 cases that we reported today start turning over into other populations. We're going to start seeing more cases back in our nursing homes. If you look at the total number of deaths, we only had 5 deaths today. And that number has been coming down pretty significantly for almost a month. But with all of these new cases, I'm getting very concerned. This is not an issue that is totally unique to our state. The United States reported that we've had our nation's largest ever single day increase in cases today. And so I want to remind everyone that as much as we want this to be over, it is not over. It is not going to be over anytime soon. We have to remain diligent. We have to do the little things that'll make a difference. Please wear a mask, because these numbers, I want you to know, they're not because of increased testing. Although Mississippi remains a leader in testing, these are not because we're testing significantly more. They're not because the rules are too loose. It's because people aren't following the looser rules that we now have in effect. We've had one simple goal since the beginning of the coronavirus. We believe that every single person that can get better with quality care should be able to receive that quality care. That's the reason we ended elective procedures so that we had hospital capacity. It's the reason we had a plan in place so that if we had to surge, that we could. But the fact of the matter is that simple goal is now threatened. In our conversation today, Dr. Dobbs tells me that we are trending closer and closer to our hospitals being in real trouble. We are continuing to work on options for additional actions that we can take to prevent our healthcare system from getting overwhelmed. But look, I know there's been a lot of discussion, there's a lot of debate. Everybody wants to talk to you about things going around in the country, things happening in our capital, potential votes that are coming up here and there, and I understand all of that. But what I want you to know is that the virus is real. None of us have been perfect in responding to it. I've shaken people's hands. I've not worn a mask every time I should have. You don't have to be perfect, but I need you to not give up. Please, let's work together to slow the spread of this virus for the days and the weeks and the months ahead. We can do the things that we're doing now in society in a safe way, but we got to be smart about it. Thank y'all. I'll be back to you soon. God bless Mississippi.